Hi everyone, this is another one of our video educational series. It's where we discuss a lot of the common questions that we get asked from and inquiries that we get from patients. So today our topic is, well, what makes the difference between getting just an implant for breast augmentation and why do some women need a full breast lift? It's one of the commonest questions that we get. Sometimes we get assessments where a lot of women are thinking that, look, we'll get the implants and get it done, and they really can't sort of really understand, why they would need a lift. So in the great majority of women who have breastfed, who have lost a lot of weight, would probably end up requiring a breast lift. Not all. We do see maybe 3 out of 10 women who have breastfed, and they're usually the women who sort of had small breast to begin with. So it all has to do with nipple position. If the nipples are pointing downwards, they're not as perky or high up. And naturally, if you think about it logically, if we put in implants, those implants are just going to push the nipple down further. Okay, so the nipples have to be at a certain position that when the implants go in, that they get lifted upwards. It's a mechanical lift. And in most naturally young, fit, healthy people with normal sort of development, that's what we get to see. But naturally, as time goes on and things change and we're in different phases of our lives, we usually see about sort of 3 peaks of this sort of surgery with implants. One is the early 20s. Naturally, a lot of women have had self-confidence issues because they haven't had a lot of breast tissue and they wear a lot of push-up bras, and there's a volume deficit developmentally to begin with, and that's when we put the implants in. Usually in the great majority those women are young, fit and healthy, as I said, and the implants will do because their skin elasticity is good, their body tissue, everything is quite young and healthy, and they can just do with implants, and that gives them that volume and fills out the bra size. The other peak that we see is the same women or women who are now in their maybe early 40s or late 30s who have breastfed and have now moved on, gotten married and have had kids. Naturally, as we all know, having children has a great toll on a woman's body, and hence what happens is the commonest thing we see is that due to the enlargement of the breast during breastfeeding, the skin gets stretched. Naturally there is asymmetry because of breastfeeding, one side is droopier than the other, and in generally the upper pole fullness, the upper chest is sort of lost and everything flattens out more from on top, and the skin becomes saggy and droopy. So that's one of the effects of, and you can also get that even if you haven't had kids or breastfed, if you've lost a lot of weight. So if someone was quite large and they lost a lot of weight, as some people have, then you have the same effects. The mechanisms are the same. If that was to happen, then we need to do a breast lift to bring the nipples up to that position as it was before. And in order to do that, we need to excise some of that skin. So it is a lengthier procedure, a bit more invasive procedure, with a bit more scarring. We do cut around the nipples, get rid of the excess skin and lift everything up. And in 90% of the lifts that we do, we would also use the implants to enhance that volume. Usually rounds, high profile is what you would prefer. The reason for that is that it gives that nice fullness on top, which a lot of women really miss and lack after the breastfeeding component especially. Now, from our point of view, we would prefer to do implants alone. It's a much simpler surgery, much quicker surgery, much with less scarring, quicker recovery than the lift. But unfortunately, if a lift is required, that's what it is. And the reason I'm talking about this is we get a lot of women who then don't want to get the lift naturally because it does impact on recovery, scarring, the cost of it as well. And everything, nipple sensation can be affected, the ability to breastfeed can be affected. So lots of issues going in that regard, but surprisingly we do see a lot of women who have gone overseas or have come back and unfortunately have gone for the option of the implants, and it's essentially trying to cut corners, and they've come back and with a lot of them with what we call a waterfall deformity of the breast, whereas the breast has been pushed downwards now. They come straight back and want it corrected and fixed. So it's always harder to fix something once it's sort of not done the right way in the first go. So here's where we advise that, you know, please be wary that if a lift has been suggested, that there are reasons for that, and you know, trying to compensate for that. A lot of women say, what if we go for bigger or high profile teardrop implants, try to lift it up? And I think that is a recipe for disaster in some, especially if a clear-cut lift is required. There are patients where they're very much on the fence, and you know, there are things called a crescent lift or internal mastopexy, and there are ways of going around it, especially in younger women who haven't started their careers, or women who haven't had children, or they, you know, they haven't been married yet. So in some cases the full lift might be a bit of an you know, an overkill in that sense, that it might be a bit early. So either we say, look, finish your family off and then come in, or we try other measures such as that. But in most women who've sort of breastfed and finished their families and in their late 30s, early 40s would require a full lift, which would sort them out for the next 10-15 years. And you know, the implants in those situations can be disastrous because they will actually push the nipples downwards and make things worse in that regard. But what I've found from a lot of patients who we've done this surgery on, it is one of the most gratifying surgeries from a surgeon's point of view and from a patient's point of view. The commonest comment we hear is, why didn't I do this earlier? The reason for that is because after becoming a mum or losing all that volume on top, you know, it's been that long that they've lost all of that volume up here, that when they get it back with a high profile round and everything is lifted up and perkier, they, you know, essentially getting the pre-baby body back. You know, women just, you know, are very, very happy with it. I hope this video helped, and if something, if you wanted to ask any more questions, or if something was unclear, please email us, and we'll be happy to go through that with you. Thank you very much.